Okay, let's dive in. I want you to think about a medical crisis, but maybe frame it with the kind of urgency we usually reserve for, say, a heart attack or a stroke.
Yeah, that's exactly the framing our source material uses today. It's quite striking, actually.
It comes from the epilogue of a major textbook, Limb Salvage of the Diabetic Foot, and they introduce this term. It's designed to make you sit up and listen. The diabetic foot attack.
And using that term attack, it immediately shifts the perspective, doesn't it?
Yeah.
It puts a severe diabetic foot problem into this category that just screams for immediate decisive action.
Absolutely. So our mission for this deep dive is really to pull out the essential insights here. We want you to understand why it's framed so urgently.
And crucially, what the source says is absolutely vital for, spotting it early and intervening fast enough to prevent the really, really bad outcomes.
And those outcomes, they can be truly devastating. The source points to what it calls the three great pathologies converging in the diabetic foot. This is quite critical.
Right. You've got the nerve damage neuropathy, meaning you might not even feel an injury starting.
Then there's poor blood flow, ischemia, which really slows down or stops healing.
And then the third piece is infection finding its way in.
Yeah, and the source argues it's not just having one of these, it's the convergence, the combination. That's what creates this, well, this biological perfect storm.
A perfect storm that can lead to incredibly rapid tissue destruction. Tissue death necrosis is the term.
And that speed, that aggressive tissue death, that's really the core horrifying feature of what they're calling this diabetic foot attack.
It's fascinating and terrifying how that convergence just accelerates everything. It's often not this slow, gradual worsening people might imagine. It can escalate to widespread necrosis really, really quickly.
Which explains why the source is so emphatic about early diagnosis and immediate intensive treatment being absolutely non-negotiable. You just have to get ahead of it.
You have to somehow break that cycle before it runs away from you.
So, getting ahead of it. What does that actually look like? The source gives some really concrete examples for you. Things like healing an ulcer before infection takes hold.
Right. Or eradicating an infection before it causes significant tissue death, that necrosis we mentioned.
And treating the poor blood flow, the ischemia, before it leads to irreversible tissue death gangrene.
Yeah, and there's also Charcot foot, that condition where bones weaken suddenly, leading to deformity and ulcers. You need to catch and manage that ideally before or right as the deformity sets in to prevent those secondary ulcers.
These are all crucial proactive steps. But okay, what happens when a foot is already clearly threatened? How do you actually fight back against this attack?
Well, the source lays out 6 key areas, 6 fronts where control needs to be established, like right now, to regain stability.
6 areas. Wait, what are they?
They talk about comprehensive control over wound management, dealing directly with any break in the skin, mechanical load reduction, basically, taking pressure off the foot.
Okay, makes sense. What else?
Microbiological control, tackling the infection head-on. Vascular, improving blood flow wherever possible. Metabolic control, getting blood sugar and overall health under control. And finally, educational aspects.
Educational, meaning?
Meaning ensuring you, the patient, and any caregivers fully grasp the risks, the urgency, and exactly what needs to be done for care.
That list, it really highlights just how complex this is. It's not one single thing. It demands a multi-pronged attack, so to speak.
Exactly, and the source is crystal clear on this. You can't effectively tackle a diabetic foot attack without the specific skills of a dedicated interdisciplinary care team.
Right, not just one doctor. You need different specialists working together.
Precisely. Vascular surgeons, maybe endocrinologists for the metabolic side, podiatrists, infectious disease experts, specialized wound care nurses. They all need to be working together seamlessly, ideally in a dedicated clinic that provides ongoing coordinated care.
It really paints a picture of a complex battle needing a unified command structure, doesn't it? To manage all those converging issues at the same time.
That's the only way to give the patient the best possible chance.
Okay, so let's just quickly pull the threads together. We've explored this powerful, urgent concept, the diabetic foot attack.
Driven by that dangerous mix of nerve damage, poor blood flow, and infection, the convergence leading to rapid tissue death.
And the absolute need for urgent, comprehensive control. We talked about those key actions before things spiral.
Healing ulcers before infection, treating ischemia before gangrene.
And those 6 crucial areas for taking back control: wound, mechanical, microbiological, vascular, metabolic, and educational.
All needing that coordinated interdisciplinary team effort.
Right. So that brings us to the final thought, the provocative question the source leaves us with.
Yeah. Given everything we've discussed, that rapid, devastating potential when neuropathy, ischemia, and infection collide, how does really thinking of this as a diabetic foot attack, on par with a heart attack or a stroke, how does that change the required urgency?
The whole approach needed from everyone involved: doctors, nurses, patients, families.
Exactly. And maybe for you listening, how does that framing change your perspective on monitoring your own health or the care for someone you know who might be at risk? Something to think about.